Welcome back. This February, we're continuing our awareness on American Heart Month. A healthy heart is always essential, but especially during the current pandemic. People with heart disease and other medical conditions appear to be at a higher risk for more severe symptoms or complications if they contract COVID 19. How and why? Joining us now to discuss and share more is Dr. Mandeep Kainth, cardiologist at Montefiore Health System. Welcome, doctor. Thank you so much for joining us.
Thank you for having me. It's my pleasure.
Of course. So to start off, doctor, can you first please explain some of the signs and symptoms of heart conditions and which ones are most common here in the Bronx? And how about detecting those symptoms during the pandemic?
Sure. So the most prevalent cardiac conditions in the Bronx is coronary artery disease. This condition is caused by atherosclerosis, which is the buildup of cholesterol inside your arteries. This can progress and lead to narrowing of the arteries that supply blood and nutrients to your heart. And the most severe and emergent conditions would be if one or more of these arteries gets completely occluded and no blood flow occurs throughout the heart. We would call that a myocardial infarction, otherwise known as a heart attack. It's important to recognize that heart attacks will still happen during a pandemic. These are medical emergencies, and getting quick care is critical to limit any heart damage. There's a saying that time is myocardium. So identifying and seeking attention faster will not only get you better faster, but it will also limit the damage to your health. The signs and symptoms to watch out for a heart attack are chest pain, shortness of breath, and discomfort in the chest, arms, back, neck, or jaw. The key thing to remember is to not delay calling 911 because of fears that you might get COVID-19 at the hospital. And hospitals have safety measures in place to protect you from infection. And the bottom line is you're much more likely to have bad outcomes if you ignore the symptoms related to your heart condition.
Right. Thank you so much, doctor, for that background. And some of our viewers may be concerned, of course, as you mentioned, to go to the doctor at this time, but preventative care is absolutely important. And we're glad to have you here with us. But one of my questions regarding COVID 19 and heart conditions is how does living with a heart condition place one at increased risk of severe illness if someone becomes infected with COVID 19?
Right. So there was a national study that found that 90% of the patients that were hospitalized with COVID-19 have at least one underlying comorbidity.
Hmm.
So it wasn't just COVID-19 that brought them to the hospital, they also have other medical conditions. Of those 90% of patients that had these comorbidities, the most common was hypertension in about half of those patients. And then in another quarter of those patients, it was diabetes. And the remaining quarter was pre-existing heart disease. So there's a lot of data that shows that the clinical risk for severe COVID infection is associated with both advanced age as well as pre-existing medical conditions, especially when you have two or more of these conditions. It's also important to note that not only does the existence of these conditions increase your chance of having COVID-19 and severe infections, but also if these conditions are poorly controlled. So people that have poorly controlled high blood pressure or poorly controlled diabetes are far worse than people that have those conditions that are well medically managed. There's also information that shows that in addition to just having multiple comorbidities, just frailty, overall frailty has been associated with more severe infection of COVID-19.
Got it. And doctor, I recently read that a study by the Kaiser Family Foundation found that COVID 19 has reduced the diagnosis of cardiovascular disease, sharply increasing mortality rates from heart disease. Can you please tell us about the rise in heart related deaths and how these deaths could have possibly been prevented?
Certainly. So that's a very interesting topic right now. While hospitalization rates have been increased, actually surged secondary to COVID-19, there's clear evidence that patients in the US and even around the world have less commonly sought medical attention for a number of medical emergencies. This includes acute myocardial infarction or heart attack, as I was referring to before. Based on these studies, the expected ratio for mortality, meaning deaths related to heart attack, was significantly increased. But it was increased not only in the early periods of the pandemic, but also the late periods of the pandemic. And it's concerning that the rates of presentation to the hospital for heart attack have been low, even in the late periods of the pandemic, because this tells us that there are still patients who are not receiving timely healthcare.
Hmm.
Um, and the cause of the increased morbidity and the mortality, it's not still completely known at this time, but it's likely multifactorial. Um, Different things. In part, it may be related to delays in the field, longer emergency medical services response time because of safety precautions and changes to the standard procedure. It can be anywhere from in-hospital delays, um, as evaluation in the ER and treatment in the cath lab is subject to potential delays of putting on PPE and getting all the appropriate equipment. Um, but that's what's more concerning is that there's a large number of patients that seem like they're more reticent to presenting to the hospital with symptoms due to the fear of contracting the virus itself,
Right.
or due to fears of putting strain on the healthcare system, which is already overburdened. And as a result, these patients may be presenting to the emergency room later, which has been causing worse outcomes. There's also more information that there's the patients that have been hospitalized with heart attack during COVID-19 pandemic is lower. So it suggests that the older patients that are not being admitted or being represented in this cohort, perhaps they're just staying home or due to fears. And they are the ones that are more susceptible to complications if this is to happen, and we're seeing that. We've been seeing an increase in the out of hospital cardiac arrests. Patients just calling 911 because they all of a sudden their heart stopped.
Wow.
And it may be related to patients that have been having symptoms of a heart attack, but due to fears of not coming in or just ignoring it, have kind of put off getting care. So one thing that's really important is that the heart care can't wait.
Right. No, that's very interesting and very jarring data, doctor. Thank you for sharing. We've heard often that COVID-19 affects the lungs. Does it also affect the heart? Can you give us a little bit of a bottom line with that?
Certainly. So COVID-19, like many other infections, is a pro-inflammatory state. So inflammation is kind of the main driver here. And we know that the inflammation can occur in the lungs, but we also have seen cases where inflammation can occur in the heart as well. It can occur in the heart muscle itself, which gives rise to a condition known as myocarditis, which is inflammation of the muscle. It can also occur in the tissues around the heart, which gives rise to a condition known as pericarditis. And the two of these conditions can actually occur together in a condition known as myopericarditis. Uh, People that have previous cardiac conditions or a structurally abnormal heart, they might be at increased risk of developing these conditions. And even though that the degree of inflammation is mild, generally the long-term implications of these patients is not yet known. Even though the degree of inflammation is generally mild and the long-term implications of these abnormalities who have recovered in COVID-19 are still to be determined, the degree of cardiac involvement is not necessarily linked to the severity of the respiratory involvement. So, in other words, a patient that is extremely unwell from myopericarditis can have very little lung involvement, or vice versa. And there are also rare cases where fulminant myocarditis can lead to heart failure, or severe pericardial involvement can lead to something called pericardial tamponade, which is a condition in which fluid around the heart prevents the heart from being able to fill with blood, which is an emergent condition requiring emergent drainage of that fluid.
Got it. Thank you, doctor, for breaking those terms down. They're very complicated terms, but once a doctor comes and joins us on BronxNet, we're able to break it down and, explain what these things mean and how they affect your heart. So thank you. Another hot topic is, of course, vaccinations. Should people with heart disease get vaccinated? Are there any implications or risk for people with heart disease to get the vaccination?
So a strong Yes, simply yes. Patients with heart conditions should get vaccinated, especially patients with more advanced heart disease and poorly controlled cardiac conditions. Uh, of the patients that are being admitted with COVID-19, these are the patients that have been shown to have the higher rates of disease with severe infection and worse outcomes. And the risks of vaccination in a heart patient are no different than the risks for the general population. And so far, all the studies that we've been seeing have overwhelmingly shown that the vaccine has been safe and effective.
And just for our viewers to know, doctor, folks with underlying conditions such as heart disease are now eligible for that vaccine under the new protocol for vaccinations, correct? Since February 15th?
Yes, that is certainly correct. They are now eligible for these. And there have been a lot of talks between the ACC trying to get these patients a higher priority. And I'm glad that they are a higher priority because we've seen that these patients are the ones that have led to poorer outcomes. I would say, in addition to the COVID vaccine, all patients with heart disease should also get their flu vaccine. And COVID and the flu are a double threat to everyone, but especially if you have heart disease.
Absolutely. Doctor, before we go, can you please remind us of the importance of continuing regular cardiology visits during the pandemic? Again, is it safe for folks to still see their doctor, preventative care, just the importance of that?
Sure. So, regular cardiology visits in general are extremely important. And the importance of continuing to do this is intensified during this times of the pandemic even more. Going back to what we discussed previously, patients with poorly controlled conditions such as hypertension and diabetes are at higher risk than those that are medically optimized. So each time you go to your cardiologist, it's another opportunity for you and your cardiologist to work together to further optimize your care. And not only will this lead to better outcomes from your cardiac conditions, but its implications in decreasing your risk of severe illness from COVID-19 are further amplified. In terms of safety at the clinic sites, to protect the health of all of our patients, we've instituted a variety of appropriate measures tailored to each setting that include rigorous cleaning measures, sanitation dispensers, masks, universal screenings, and designated patient areas, as well as social distancing to keep you and everyone around you safe.
Got it. And finally, how can people find out more information on heart health and possibly set an appointment on Montefiore to see you or another cardiologist, Dr. Kainth?
Certainly. So Montefiore.org is a very powerful website. Once you go on there, there's a lot of tools there. There's especially a link for COVID-19 and a lot of frequently asked questions. In terms of being able to find cardiology, there's a section on that website called Find Doctor. You can search by specialty, including cardiology, and you can provide you with the phone number as well.
Thank you so much again for your time, Dr. Kainth, and thank you for joining us on American Heart Health Month, February, to talk about this important topic here in the Bronx.
Thank you.
Of course. Dr. Mandeep Kainth is the cardiologist over at Montefiore Health System. Again, Montefiore's cardiology department and Dr. Kainth are here to serve you. For more information, you may call 718-920-5949 or visit montefiore.org for more info. We'll be right back.